Hello and welcome. My name is Dr. Matui Kavita. I'm a consultant gynecologist, obstetrician gynecologist at Jija Road Hospital. I want to talk to my patients, the ones who are just about to give birth, about expectations. Any lady who is pregnant and is expecting to give birth has two major expectations, despite others other than being treated well, with dignity and all. One, to get a healthy baby. And a healthy baby, in layman's language, can be defined as a baby who is able to breastfeed on their own. And two, they're breathing well. This is a healthy baby. And the other big expectation is safe delivery. You go to hospital, you've delivered, you haven't bled too much, no major injuries, we've not let you fall, you're safe. You walked it into hospital and you walked off. These are the expectations of you about us. It's Dr. Matui and Jija Road Hospital as a team. But we also have expectations for us to give you an experience. What do we expect of you? How to behave basically during labor. This is very important. And if you forget everything else, this you must remember. And I write it in capitals. Cooperation. This is what is going to give you a whole experience about delivery, if you enjoy it or not. Please set your mind about giving birth, that a baby needs to come out for you to be able to see him or her. As much as there are examinations, sometimes vaginal examinations, which are uncomfortable, but the more you relax about it, quite hard, easier said, but the better the experience, kindly, because at some point the baby will need to pass out. Please cooperate during the whole process. And if you forget anything else, cooperation is important. When you're delivering you and you decide to go underneath the bed, we'll ask you, are you cooperating really? So most important. There are a few others which are also important. Walking around, ambulating. Studies have shown that actually walking during labor reduces the duration of the active phase of labor. Walking around, it's also fun. Two, you also need to pass urine often. The bladder, the baby needs a lot of space, the maximum space in the pelvis. When our bladder is full, means there's not as much space, so pass urine often, about 15 minutes to every half an hour. And that way when you're passing urine, make sure that you're also walking around. Number 4, we need the energy. You need to eat and drink orally a lot during labor. Long are the days when you used to starve mothers thinking that we will go for cesarean sections. Nowadays cesarean sections we do when mothers are awake. So you need to eat and drink during labor so that we need the energy at some point. Then number 5, this also find it key, breathing in and out during the pain. Labor pains are intermittent. Intermittent means that comes and goes. If labor pains were continuous, no one likely would give birth normally, but pain comes when you think that's about to kill you, disappears. During that time of pain, I want you to breathe in and out like with your mouth open. That way you do not exert pressure on the cervix and make it get edematous earlier. So don't push the baby before we tell you to. So I consider that important. So to me, cooperation is key. If you have to remember the whole experience, then of course breathing in and out during pain to try to distract you from the actual contraction. All right, number 6. Let's demystify a few things. 1, something called episiotomy. What's an episiotomy? You have a table here and slant it towards this side. And you pour water here. This drop of water is rushing towards to come get spilled here. You can, before you get something to wipe it, you can distract this by drawing. We used to do this as kids. Just draw patterns on it, just to direct the flow of the water. So we're talking about the vagina now. Vagina is there, the clitoris, the urethra. This is the introitus, where the baby will come from. So normally, this is the weakest point. This is the anal opening, and actually this is the whole idea about episiotomy. Now please listen to what I'm saying, not from what you've been told. So this is the anus, this is the introitus, this is the weakest point. So once the baby has negotiated through the bones, just the muscle now just about to come out. For some ladies, few, a very small percentage, not all, the baby's head, these muscles, they do not relax enough to let the baby's head and shoulders and the rest of the body pass through. So if we just let you be, sometimes you can actually get a tear through here. This tear sometimes can get so bad, it actually gets the anus, called 4th degree tear, and leads to something called RVF, rectal vaginal fistula, and also kills this sphincter for holding stool. So the reason I give an episiotomy is normally to prevent this from happening. The other ways of doing that by supporting the perineum here, but still we still check. For some ladies, these muscles are too tight. So what do? We divert this force, and we give lignocaine, something to make this place numb. Then we make a small cut, not a big one, a small cut, just to divert the force, to make this, to create an area of weakness through here, such that if the baby comes out, there's any tear, it goes in this direction towards the vagina, which, as the vaginal muscles, which avoids this. This one, no need to worry. We put 2 or 3 stitches, and we tell you to throw some warm salty water there. 3-4 days, it heals. This place has very good blood supply. So episiotomy, it's indicated, not in all ladies, but when it's indicated, it's a good thing to prevent all these tears. All right? Yeah. Safe delivery. Here we're talking about emergency cesarean section, is where you've tried to give birth normally, and something necessitates us to take you for cesarean delivery. And the commonest is 1, a baby factor. If a baby gets tired, in layman's language, but there are ways you know that the baby is tired. 1, something called meconium stain liquor. It's graded 1, 2, 3. 2, fetal heart rate. This is what we monitor, fetal heart rate every 30 minutes during active first stage, and every 5 minutes when the baby just about to come out. It initially starts to go high, more than the usual 110 to 160. Then the moment it starts dropping down, about actually 120 and less, trouble, we rush you for emergency cesarean section. And also a baby getting tired, the other factors, especially if using a machine called CTG, you can be able to figure out from the tracing what's happening. These are baby factor for emergency cesarean section. The reason why we monitor mothers during labor, check their blood pressure, fetal heart rate, is so that you're able to identify this earlier, so that we intervene. Because we've said that expectations are healthy baby and also a safe delivery for the mother. Number 2, commonest reasons, talking about prolonged labor. Prolonged labor, we are talking, we are a very slow progressor from about 5 centimeters to full dilatation of 10 centimeters, about 12 hours or so. If 8 hours down the line, you are still 5 centimeters and yet you are at 4 centimeters, we start worrying. Could there be something else? Maybe the baby is bigger than usual. Is there a cord around the neck which is preventing the baby from coming down? Yeah, prolonged labor is also a common indication of cesarean delivery. This is a topic on its own about how it's done, and many questions about spinal delivery, anesthesia, general anesthesia, and all that. So number 8, a colleague of mine has discussed about this. What do you come with? What to pack? You're taking a small trip. You're going to get a newborn, somebody new. You want them to have their own new stuff, baby clothes. Talking about the basics. You need for the mother You need the maternal pads, not the small ones. I know this brand, Medicot, blue or pink. Need about 3 packets or so, because there is usually heavier bleeding after delivery. Then need some cotton wool. Then you also need personal effects for yourself, a toothbrush. You've taken a small trip, just about a day, and overnight is normal delivery, about 2 to 3 days is a serial delivery. And the others, which I'm sure they'll be discussed by my colleague. And of course, don't forget your NHIF card, your other insurance cards, plus your antenatal booklet or your antenatal records, plus all the scans. Yeah. Number 9. Questions? We call it off.